Welcome back to Sky Women's Health Podcast. I'm so glad you're here today. We're going to have some important conversation, and just fair trigger warning, we're going to be talking about mental health issues, depression, suicidal ideation. So if you are not in a place where you can hear these discussions without it harming your own mental health, please seek help first. So trigger warning, don't listen with kids in the car, put in your headphones. And if you yourself don't feel in the place to listen to this, let's skip this episode. The information shared on the Sky Women's Health podcast is for educational and informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding your medical condition. Never disregard professional medical advice or delay in seeking it because of something you heard on this podcast. Reliance on any information provided by Sky Women's Health, Dr. Carolyn Moyers, or any guests featured on the podcast is solely at your own risk. You're listening to Sky Women's Health Podcast, your evidence-based resource for women's health and wellness, exploring the holistic principles of osteopathy, integrating mind, body, and spirit, designed to empower you as your own healthcare advocate and help you live your best life. I'm your host, board-certified OBGYN, Dr. Carolyn Moyers. Okay, we are talking about something that no one tells us about high-achieving women. The more impressive their CV, the easier it is to hide. Because when you're a board-certified physician, award-winning, globally recognized, nobody thinks to ask, are you okay? And honestly, you're probably not asking yourself either. That's really not the culture of medicine we push through. My guest today is Dr. Yami Cazorla-Lancaster. She has the kind of resume that makes other doctors quietly reconsider their life choices. She's a board-certified pediatrician, a lifestyle medicine physician, a national board-certified wellness coach, a published author, and the host of internationally downloaded podcast, I Am Human. She runs 2 practices out of Yakima, Washington, and has spoken on stages around the world. She also has survived depression and suicidal ideation, and she's here today to talk about it. Because what Dr. Yami figured out slowly and painfully is that the version of herself built to satisfy everyone else's expectations wasn't a version of herself that she wanted to continue to live. From medicine, religion, culture that tells women, especially high-achieving women, exactly how much space they're allowed to take up and exactly how little they're allowed to want. This episode is about all of that. And it's about the hardest thing, giving yourself permission to want what you actually want. Let's get into it. Welcome, Dr. Yami.
Oh my goodness, that intro gave me full body chills.
Oh.
Thank you so much for having me. And I really do think this is such an important conversation. So I'm very, very honored to be here today.
Oh, thank you. I love that you so vulnerably share your journey. So everyone, Dr. Yami is my longtime friend. We went to med school together. I started following her original podcast, which was Veggie Talk Radio?
Veggie Doctor Radio.
Veggie Doctor Radio as a plant-based pediatrician years ago when my kids were little. And actually went plant-based for some time during my 3rd pregnancy. So
wow, I didn't know that.
Yeah. I'm very plant forward. I love my plants. But anyways, so I followed you all along, and then you reached out at some point in the last year, really suffering. And whenever I heard you come back online with your podcast, I Am Human, I was just like floored. And now we're in the same entrepreneurial physician group. And I thought, oh, this is such an important conversation for my listeners to hear, because I have these conversations in the exam room every day with high achieving women who feel trapped in a lot of ways.
Yeah. Well, I'm very grateful for my perimenopausal journey. And I'm actually very grateful for you because I think it's just crazy that we're having this conversation because you were so important to me finding the help that I needed, I reached out to you so desperate. And it was actually almost 2 years ago, 18 to 24 months ago, where I really hit that rock bottom in my symptoms. And I remember messaging you on Messenger and like, what can I do? What should I do? And you sent me some articles, and a lot of it really started making sense why I was feeling what I was feeling, and slowly starting to take steps towards getting better and feeling better.
Yeah. Yeah. And I think, there's so many aspects to think about. And I didn't even know the depth of your struggle, right? I didn't know what was going on, except for that you were really struggling with your mental health. And there was a lot in life and practice, that might have been contributing, but also this hormonal shift that you were experiencing. And we know that women, as we go through this menopause transition and we have these erratic fluctuations in our estrogen and progesterone levels through the ride of perimenopause. I think one of the things that I told you is like, yes, and guess what? It can last longer and be more severe in women of color. And that's something you had never heard before.
I'd never heard really anything about perimenopause, to be honest. And you know how this goes, right? Our medical training can be so inadequate in some ways when it comes to real life. And I also have some friends here in Yakima that are OB-GYNs who they remember just telling women what they had been taught early in their career, right? Before they hit perimenopause. And now that they're in perimenopause, they're so embarrassed. They're like, oh my gosh, I can't believe I said those things. And now I know what it's like. So we are starting to have these conversations. They're very, very important. And I'll say probably my symptoms actually started in my late 30s. And just like you said, it starts a little bit earlier, can be a little bit more severe, can be longer lasting in women of color. I didn't know that's what it was, but I initially started with brain fog, which to me is super frightening because I'm a public speaker and I love feeling sharp. And on top of it, I run a business, now two businesses, and I just want to feel sharp. So when I first started having that brain fog, it freaked me out. And I remember having so many conversations with my husband. Maybe I'm getting dementia. Maybe I'm getting Alzheimer's, because I had never experienced that. Like, you can't find the vocabulary word that you're looking for. Just like, it's just foggy. Like, it's not sharp. But now in retrospect, I realize, oh, those were just my first symptoms of perimenopause. But what really just threw me off the rails and really changed my life in a dramatic way was how it really affected my mental health about 18 to 24 months ago. And I had had little blips. I started experiencing depression in my adolescence. And before we started recording, I talked to you about this, of like piecing this all together, knowing that people that have experienced mental health issues are more likely to have more severe mental health issues during their perimenopausal journey. That's something I learned also. So that all made sense. So I started having depressive episodes. I had pretty severe one when I was a teenager, another severe one right after residency, but I had been really good. I went plant-based, and going plant-based and getting healthy and feeling really confident about my lifestyle. This really threw me for a loop because it seemed like it came out of nowhere. Now, granted, my mother got diagnosed with breast cancer. I also had a change in my business to where I decided myself to stop podcasting, to stop doing the content creation, all the creative stuff that I love and that gives me life, and just go all into pediatrics full time, which we can take a little side branch and talk about that in a little bit. And I just like sunk like a rock. But what was very strange about this depressive episode is I feel like it completely affected my self identity of who I was. It was very confusing. I had never had depression quite like this. It also gave me what I can only define as self rejection, almost like a division of, I don't even want to be Yami anymore. Like, I couldn't even stand the sight of my own name, which is strange. I've never experienced that in my life.
You're just disgusted with yourself.
Yeah, and it's not the same kind of self-loathing I had before when I was a teenager, like, "Oh, I'm so fat." It wasn't like that at all. It was like, I don't even want to be me anymore. It was so weird. It's even difficult to explain, to the point where I don't believe in demons. I know that people do. I don't believe in demons or hell or any of that stuff, but I was like, am I possessed? Like, what is wrong with my brain? Why do I just don't even want to be myself, to the point where I was suicidal, and I wrote a note. It was that bad.
Like you had a plan.
I had a plan for the first time in my life. And, I've had very bad depression before, and, that kind of like, I just want to be dead sort of thing. But this was way different. This was way different. It was a level of depression that I had never experienced in my life. And it just felt like I was never going to get better. And I think, okay, I will also want to throw a caution out there, because one of my good friends is a therapist, and she realized I started doing this. I started reading everything I could on the internet about perimenopause and depression and mood stuff. And unfortunately, I came upon Reddit threads with women who said they're nothing that they was doing was making them better, and they just weren't getting better, even with HRT. And so then that made me more hopeless. And so she was like, you need to stop reading all of that stuff on the internet and just do what you can, and just try to do what you can to get better. But you can definitely find really hopeful things. And if you go searching in the wrong places, you can also find things that are going to support how you're feeling and make you feel worse about yourself. So I caution people out there. And I think what really helped me was finding somebody who was educated, knowledgeable, and experienced in treating these symptoms, and really just help get me straight. And I will say, I don't think we talked about this before I started recording. I did get on an SSR. Well, not an SSR. I got on bupropion. And I don't know why, but you know how doctors are. I prescribe this stuff. I prescribe medications. I believe in them, but I had never taken one myself in my whole life. So I don't know why I was so fearful. And in my head, I was convinced I just need estrogen. That's what I need. That's what's going to make me better. But I was also having a lot of bleeding issues. And so I was advised probably that's not the route to go. But with my treatment plan, what ended up working the best was staying on the NuvaRing continuously to stop my bleeding, because being on the NuvaRing 3 weeks and then off 1 week, that's when I noticed my symptoms would get worse when I came off. Like I would just like plummet, like with 2 days after taking the ring out, it was just like boom again, like worse than worse, right? So staying on the NuvaRing continuously, and then to get over that hump, to add that bupropion. And I was so scared. I remember I got the pill bottle and I was like praying. I was like, okay, I'm going to take this. I don't know why I was so scared, but honestly, it saved my life. It really saved my life.
Yeah.
Because I didn't realize before I started taking that medicine how bad I mean, it was bad, but I don't know how I made it day to day. Honestly, I was so irritable. Everything was so heavy and difficult for me. And I started taking that medicine, and suddenly I was like, wow, life doesn't have to be this difficult. It was crazy. So I'm off of it now, but I was on it for a few months, and it really helped me as my body was adapting to being on the NuvaRing continuously. My period stopped, things stabilized, and I finally was able to recover from that horrible experience.
So are you seeing a psychiatrist and a menopause specialist? What does your care team look like?
Okay, well, you know how doctors are.
Yeah,
See, everybody that's listening don't necessarily do what we do, okay? But one of my also very good friends from medical school is a psychiatrist. So I was consulting him on the side and asking him what he thought. And he helps women with cancer, a lot of them that are having medical and surgical menopause.
Yeah.
And so he'd been through it. And so I talked to him about it, and he advised me and really helped me. So I didn't technically have a psychiatrist, but I had my side psychiatrist. Yes.
Yeah, yeah, yeah. You did phone a friend, and then your
Yeah.
mental health specialist wrote the prescription. Yeah.
Yes.
Yeah. Okay. Well, so this is such an important topic for us to discuss, and I want to just share this piece on from the Menopause Society and the hormonal position statement specifically on depression, because we know that it worsens as women transition through menopause. The evidence is mixed as to whether depressive disorders are more common during menopause transition relative to premenopause. But most women who present with depressive disorders during that menopause transition are women who've had a history of depression before the menopause transition. And women with a history of depression are higher risk for recurrence during the menopause transition. So, for that reason, the clinical guidelines recommend that clinicians screen for depression in women with a history of depression and use antidepressants or proven psychotherapies, like cognitive behavioral therapy, as the primary treatment for recurrent major depressive episodes, and use hormone therapy to treat the menopausal symptoms, such as those vasomotor symptoms, the hot flashes, the night sweats, the disturbed sleep, the vaginal dryness, etc. Vasomotor symptoms increase the risk for elevated depression symptoms, in part because of that sleep disruption from the vasomotor symptoms and on a day-to-day basis. And estrogen therapy shows some efficacy in the management of depression in midlife women, but its effect varies based on the menopause stage. So for perimenopausal women with depression, there's evidence that estrogen therapy actually improves depressive symptoms to a degree similar to antidepressant medication. The antidepressant effect of estrogen therapy applies to perimenopausal women with and without vasomotor symptoms. So whether you're having the hot flashes and the night sweats or not, and in women with major depressive disorders with estrogen therapy, depressive symptoms improve in relation to improvement in sleep.
Mm.
Estrogen therapy does not appear to be effective in treating depressive disorders in postmenopausal women. So this is very, very interesting that this hormonal shift can wreak so much havoc, and it's replacing that estrogen, stabilizing that estrogen that helps us so much.
Yeah. And I think, I talked to 2 or 3 doctors before I finally because we don't have any menopause trained people here, and where I'm in a small town.
Yeah.
And I really felt like I wasn't being listened to, which also worsens your depression, because then you feel hopeless. And unfortunately, because I didn't have very many other symptoms, my main symptoms were that brain fog, the depression, the mood symptoms. Every once in a while, like, I really haven't had very many hot flashes. I have some night sweats every once in a while, but I wasn't really having the typical symptoms. And because of that, a lot of people that aren't experienced and trained, they'll be like, well, that's not what's going on with you. And it makes you feel kind of alone.
Oh yeah. Oh, you are speaking the language of so many of my patients who walk through the door. They've seen this specialist and that specialist, and they've gone down this rabbit hole, and they've seen this provider and that provider, trying to make sense of just this. Sometimes they can't even describe it. They just don't feel like themselves anymore.
Mm-hmm, mm-hmm.
And they've been told, well, you're fine. Your labs are fine. Everything looks fine. And they feel gaslit, and they sit in their car and cry because they're like, but I don't feel fine. Something's got to be wrong. And I think that the piece that we're missing, and it's really unfortunate because since the Women's Health Initiative, we've got 2 decades of physicians who are poorly trained, is that perimenopause is a clinical diagnosis. There's no lab that defines you as being perimenopausal. So I'm sorry that even you, as a board certified physician, experience the same damn thing.
Yes, and I had to be an advocate for my health. But I'm one of those people that I just cannot stand not feeling good. So it's like I have to feel, I need to find what helps me feel better. I also want to go back to what you were saying. Something that I learned
Yeah.
while I was experiencing this is that women have a spike of suicidal rates between 45 and 55,
Yes.
which
Yeah.
tends to be that perimenopausal range.
Yeah. Yeah. So what was that? What finally broke where you reached out for help?
Well, I think it was writing that note. And I'll tell you, my story is very complex and it has a lot of different aspects to it. But I knew that I needed to stick around mostly for my older son because he's struggling with his own mental health issues. And so I had to stay. So it wasn't an option to go. And so I had to get better. And I knew that there was something that had to be done. So I just didn't quit. And that's when I finally found the menopause specialist and told them what's going on. And it was such a breath of fresh air because it was a complete understanding, and it correlated with what you had said too. And so that really helped me. And then just slowly getting on the right treatment plan. Of course, it wasn't just like an overnight thing, but within 6 weeks of getting on a good regimen for myself, I was starting to feel more optimistic and hopeful and have more energy and motivation. And I will say that that's the hard part for someone like me too, is I had zero. I'm so goal driven that I was like, I don't care about anything. I don't want to achieve anything again for the rest of my life. I could just disappear now into the ether and it wouldn't matter, like, and so that's totally not like me. I was born with goals. And so that's why it was like that. Once I started feeling that glimmer of like, oh yeah, I want to create this and I want to do this, I felt like, okay, Yami's coming back. My personality is coming back.
So let's talk about that a little bit. You wanted to be a doctor since the age of 4.
Mm-hmm.
You achieved a doctor. You're running your own practice. Your nurse practitioner leaves, and all of a sudden you feel like, wait a minute. I was planning on exiting. I have these other creative goals I want to do. And you were stuck in the shoulds of life. I should continue to be a pediatrician because I've been a pediatrician and that's what I was trained to do. And am I giving up or am I failing? Am I disappointing my patients? Da, 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 da. Like you just were starting to feel trapped because your soul is wanting something else.
Yes. And that's why I said a few minutes earlier that I'm grateful for the perimenopause journey, because I also think maybe there's something to it, that we get this shift in this time of our life where we don't give an F anymore. We're like, listen, it's our turn. It's my turn.
Yeah.
I want to do what I want to do. And I'm starting to care less and less about what people think. I'm not great at that. That's actually one of the things I struggle with is I worry a lot about what people think,
Sure.
but it's starting to get way better. And I think I'm getting to that point in my life where I realize it's my life and nobody's entitled to tell me what to do or to own me. And so I did have to make some really hard decisions, knowing that in the depth of my depression, part of it was I don't want to do this anymore. I don't want to be a full-time primary care pediatrician, even though it's one of the most beautiful places of privilege and it's a great honor. And I have loved it, but it's okay to change my mind. It's okay to change my trajectory and follow my joy and follow the things that really light me up. And since I was able to make that decision with a lot of help from a couple of coaches and friends, and
Yeah.
AI actually helped me a ton because AI is able to just like slice through all of that emotion and help you see things really objectively, which helps so much. Like, oh, okay. Like AI is basically like, okay, you want to die. So explain to me why you should keep doing this, So it like puts things in a way you're like, okay, yeah, that makes a lot of sense. And so with help from a lot of different places, I have started to take steps towards creating my dream life and feeling like it's okay. It's okay to design the life I want to live at this stage. And it's okay to change your mind at any point.
Yeah. So I was listening to your podcast when you talked about your journey, and a couple of things resonated with me as I was hearing you talk about, your upbringing and religion, and this, where we should and we're doing of service, et cetera, et cetera. But your shift is, it's not like, you know, I don't know. It's not like you're going out to do something selfish. You're still wanting to serve people. It's just in a different capacity now because you've evolved as a person, and you have different interests, and that's okay.
I know. And it's crazy because if you talk to a friend, they're not going to tell you those things that you think to yourself. But as women, especially, as servants, especially, when we make a change, especially if it's something that feels so good to us, and in some ways, public speaking, podcasting, it feels pretty effortless to me.
Yeah.
And I think because of that, because of my upbringing, I have this really deep, strong work ethic. It feels selfish. It's a weird thing. So to me and myself, but from someone looking out and looking in, like, but of course, it's also difficult whenever you're a physician, especially if you own your own practice. You have this patient panel, people that you feel depend on you, people that you feel are going to be so disappointed if you change your direction. And that feels like a big burden on my soul. Like, oh my gosh, I really don't want to harm people or feel like
You're abandoning them.
like I'm abandoning them. And so I think that's what I struggled with the most.
But you have built this beautiful practice. You've hired other physicians and mid-level providers that can help to serve your patients well. So what is this dream? What is it that your soul wants? That we're letting go of the conditioning, the shoulds, and we're allowing ourselves to want what we want. What is it?
Honestly, my dream is to be a very well paid, highly sought after international public speaker, motivational speaker. I'll say that now because when I first started saying that, I was just like, oh my gosh, people are going to think I'm just like one of those gross, like used car salesman type people. But listen, I feel like I'm gifted in that area and I just love it. And I love being on the stage. I love the lights. I love prompting an emotional shift in people and helping them feel inspired and empowered and hopeful and happy. And that's really what I want to do. But I've started creating that path through my lifestyle medicine practice that I started in October, which is comprehensive lifestyle medicine programs for people so that they can start feeling better, shift their health and well-being, and from there kind of take me on to that road of public speaking.
Yeah, amazing. Yeah, because you're motivating people to live their best, healthiest life.
And a lot of people don't realize that when it comes to behavior change, when it comes to making big changes in your life, a lot of it does have to do with your beliefs, what you allow yourself to have. And I have noticed a lot of people that come to me, we work a lot. One of the pillars that I work on is purpose, love, and connection. And I see so many women struggle with creating their vision. It creates fear inside of them. They have a lot of difficulty letting themselves imagine joy and happiness. This is a very common thing that I've realized. It wasn't just to me, it's a lot of people. And those same people may struggle in different aspects of their life, whether it's their health, their body, any of those things. And so really it's kind of the same work, but in a container of health and lifestyle medicine.
Yeah. It's beautiful. Okay, one of the other things I heard you say is that you're building the body of your dreams. And I'm like, ooh, do tell. I'm adding this to my list of goals.
Yes. Okay, this has also been a really weird thing because I wrote a book on intuitive eating, and I am still a huge proponent of intuitive eating, especially for children, because I don't feel that we should raise kids on diet culture and on being a certain size or any of those things. So I still am a big proponent of that. But obviously, for me, especially in perimenopause and having a history of emotional eating and binge eating, I have had to go back to tracking and being very mindful of what I eat. And at first, that was a big conflict in my values. But I don't know. I feel like this has been a goal for such a long time. And I was like, you know what? I'm going to let myself have it. And that was that shift that I needed of I am allowing this. And suddenly all of the weird emotional diety stuff has gone away. And it's just this objective thing.
Body and yeah.
Yeah. And I'm very close, but honestly, I never thought this would be possible. I have visible abs now. I have people at the gym stop me and tell me that I'm inspiring them. Cause also I'm not gonna lie, I'm gonna be completely honest here. I love looking cute in the gym. Okay. So
Right.
I wear like these
She's like, look, I'm just
amazing
okay.
gym outfits. Okay. I'm a little bit of a show off and I'm working on my calisthenics and people stop me. And what I love about it, it's usually women and it's usually older women.
Mm-hmm.
And they stop me and they're like, oh my gosh, you inspire me. I've been watching you and I want to work up to what you can do. And one woman said I had quote washboard abs, which I don't, but I was like, you know what? I'm going to take it. I'm just going to take the compliment. And I never thought I would ever get into this kind of shape in my entire life. And here I am. But I just want everybody listening to this to hear this. I had to allow it. I had to be okay with letting myself get there because I did have this conflict. I think a lot of us have this conflict between what we want and what we allow ourselves to have. And the only reason I'm able to be here is because I've allowed it.
So let's talk about that a little bit. That sparks in me this thought of so often women in general are shaming their body, right? Hating their body, just really grossed out by their body because it doesn't fit what their expectations are, or society's expectations are, or what their 20-year-old body was. And this is an interesting concept of loving and leaning into and allowing that I'm going to have the best body, the body of my dreams. How does that, like, you see what I'm saying with that
Yes,
thought shift?
it does sound like a conflict, but I will tell you, when I was in the depth of my depression, even though I couldn't stand the sight of my name, something weird happened where I suddenly, for the first time in my life, accepted my body and I gained weight. And I'm not trying to diss my husband because I have one of the best husbands in the world and I'm madly in love with him, even though we've been through our ups and downs for the first time in our entire relationships. And I've been every weight with him. I don't know why this happened, but he told me that he was worried that I was going to gain too much weight and he wasn't going to be attracted to me because I was very depressed and I emotionally eat. Okay. So at the depth of my depression, heck yeah, I was comfort eating.
Yeah.
And it kind of hurt me a little bit. But at the same time, I would look at the mirror and I'd be like, damn, I don't know, but I feel beautiful, which makes no sense because I was very depressed.
Yeah.
I don't know.
See at the side
None of this makes sense. Okay. I will just tell you. So I got to the point where the depression, even though it had for the almost every other time in my life been about my body, for the first time, it wasn't about my body. And I got to this level of acceptance with my body that I truly love my body no matter what. And so as my abs started coming out, as I started getting this definition, as I was able to do crazy things, like I can do weighted chin ups now with 15 pounds. I can do 6 weighted 15-pound chin ups, my body weight plus 15 pounds. Like I can do all these things. But even like if I think in my head, well, if I gain the weight back and I have a pudgy tummy and all this stuff, it's fine. It's just a body. But I'm also enjoying the challenge of like, let's see how we can sculpt this body. It's almost like you have to get to a level of acceptance in order to relax enough to work on the things you want to work on.
Hmm. Yeah.
It's a strange thing. I don't know if that helped anybody at all, but that's kind of what's happened with me. And that's why I think it's working for the first time in my life.
Yeah. I think it's beautiful. I think it's beautiful to allow yourself to want what you want and to go for it, right? But it starts with having the energy and the support and feeling more like yourself. And I'm so excited for you. You're a pediatrician, a lifestyle medicine physician, a wellness coach. You've hosted thousands of podcasts, like you are doing all the things. And even in the midst of that, successful life, you were feeling lost and not yourself and wanting to exit this. And I think that it's important for us to know that this happens to everybody. It's universal, in terms of like there's no amount of money or number of degrees that is going to excuse you from this human existence. And so I just am so honored that you reached out to me and that you got the help that you needed. To be a part of your journey is just an honor. But so honored that you shared with my community your journeys, your struggles so openly. Thank you so much.
Well, I thank you. I appreciate you so much. And I do believe that God led me to you to ask you those questions to start healing. But I'm just so grateful that you exist and that women like you exist to help people like this, because it can be a lonely place where you feel like nobody's listening, nobody believes you. And I'm just so grateful for everybody listening to this. If you know that something's not right, you're in that stage of life where it could be perimenopause, find yourself somebody that is trained in this area, that is experienced, that knows what they're doing, so that you can get the right help. And also just be patient and know that it can take a little bit of tweaking. I'm sure that you tell people that too, right? You start with a regimen, you may have to tweak it and see what works. Every person's a little bit different, but you don't have to feel that way. You don't have to feel miserable, and there is hope. Don't give up. Don't give up.
Yeah, absolutely. You're going to make me cry here.
Aww.
Yeah, it is. I mean, I think that's one of the most powerful things that I really want women to know, is that because I have, people who come in the depths of despair. Some people are on suicide watch, right? And it's very interesting. I'm like, I wish I could take you next door and let you meet the lady who's been at this for 2 years, who's thriving and feeling her best. It's so often that it happens that patients come in and go, I haven't felt this good in 7 years. I haven't felt this good since before I had kids. I mean, it happens every day. So yes, do not give up. And that radical, necessary act of giving yourself permission to want what you want. And Yami, I so relate to that, because this week I will deliver the last babies ever of my career. And I
Oh
have
my
said to
goodness.
myself many, many times, do I have to deliver babies because that's what I was trained to do for the rest of my life? Because I really want to sleep in my own bed and serve women of midlife. And so my little locum time is coming to a close, because Sky Women's Health is thriving and needs more attention from me. And I am allowing it.
Yes. Oh my gosh. More full body chills. I am so glad you verbalized that out loud. And I want more people to lean into that. What is it that you truly desire? Because some people are also blocking that. They're not allowing themselves to even think about what they want, because they judge it right away. And so they're just like, nope, not even going to go there. But I'm so glad you're verbalizing that you also have been through this. Like, I'm trained to do this. I spent so much time doing this. I'm really good at doing this. I'm sure you're excellent, right? You're excellent at delivering those babies, right? And people trust you and they tell you afterwards how amazing you are. And so that's what makes it difficult sometimes to be like, but I don't want to do this anymore. And there's only one of me, and there's only 24 hours a day. And I want to spend more time doing this other thing that lights me up and that fulfills me.
Yeah.
And that's what you should be doing, because whenever we're serving at that high vibration where we feel good, we feel aligned, we are spreading that beautiful high vibrational energy. And I think that we're also giving other people permission to make that choice for themselves. And I think the other thing that happens when people start thinking that way, they start thinking, well, if I just let myself want what I want, then it's just going to be like this huge mansion on the beach and $5 bazillion. But that's not true. We literally all want different things. So
Yes. Yep.
let yourself want what you want,
Yeah.
but you have to get clarity on that, you know?
Yes. I also think that that little nudge, that little inner voice, that's I feel like that's the nudge from God. Like that is him speaking through us. Like there's a reason that your soul desires this.
Yes. And it's meant for you. It's yours. It's personal. So it's okay. It's okay to embrace it. But I will add a caveat to that. It may not just be one thing in your life, right? Like I did truly fervently want to be a doctor since I was 4 years old. And I pursued it and I did it. And I've been practicing medicine for 17 years. And now I'm just like, no, I want this thing. And that's fine. You
Yeah,
don't have to want the same thing your whole life.
that's right. That's right. That's right. Well, Dr. Gami, again, thank you, thank you, thank you. Please let everyone know all the many places that they can find you.
Well, I am on too many places. So I'm just going to give you two. My podcast, which you can find anywhere podcasts are broadcasted, I Am Human. And I have all my podcasts, even from when it was Veggie Doctor Radio. So if you're interested in plant based lifestyle medicine stuff, it's there. But now I've shifted more to talking about this, talking about letting ourselves want what we want and why it's so difficult to do that. So I would love for you to listen in if you're interested in that topic. And my YouTube channel and Instagram at the Dr. Yami. You can find more variety of things there as well.
Okay, great. I'm going to go follow you because I don't think I'm following you yet.
Thank you.
If you or someone you know is struggling, the 988 Suicide and Crisis Lifeline is available 24/7. You can call or text. Please reach out and ask, your loved ones. If you see someone just not feeling themselves, not just ask, give space for people so that they can get the help that they need. Until next week, be well. Thanks for listening. This episode is sponsored by Sky Women's Health. If you love this episode, follow the show so you never miss one. Share it with the women in your life and help more people discover it. Let's make it binge-worthy.